Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
You're listening to Healthcare Matters, the podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. With us, as always, is Dr. Robert Popovian, joining us from Washington, D.C. You know he's a pharmacist, he's an economist, and he's the Chief Science Policy Officer at the Global Healthy Living Foundation.
And joining me is my good friend, Connor Mertens, as always, my co-host, and our numero uno patient advocate and community outreach manager at the Global Healthy Living Foundation.
Thank you for listening to us and for all the positive feedback. Let's start with a listener comment. This one's from Sean P., who wrote, "Very informational podcast. I learned a lot."
Please keep the feedback coming, and as always, make sure to spread the word by rating our podcast or writing an honest, positive review. We really appreciate it. So, Connor, let's get into this week's episode. What does the number 2,566 mean to you?
I like that we're doing this new theme of numbers at the beginning of our podcast, but this one rings no bells. But it sounds pretty specific. What's 2,566 mean to you, Robert?
Well, those are the number of Americans who passed away, unfortunately, from COVID in the last 7 days.
That's 7 days.
Yes. So we lost 2,566 Americans.
Well, Robert, sounds like today we'll be talking about COVID. And with that, let's dive in. Can you tell me more about this number? What does that say about where we're at in the pandemic? We're definitely skipping over the question of, are we over this pandemic? Because the answer is no. What do we need to know about where we're at in the pandemic right now?
So where we are is that we are trying to get people vaccinated. We're trying to get people healthy if they're not vaccinated, or even if they are and they have breakthrough disease through oral antiviral therapy or antibody therapy. And that's where we are. We're trying to manage a disease that is going to be with us for quite a while. And that's what we're going to talk about today, is that what is the new stuff that's coming out for COVID-19 with regards to new information about the vaccines, the therapies, and how we may ask patients to work with us on getting themselves better care.
So we can say that the rollout of the vaccines and therapies has undeniably helped curb deaths and hospitalization rates, and governments are exploring how to manage COVID going forward. But that number you said, 2,566, is still a number. Those are all people. Those are all real lives that we're losing every week from this disease. So the question is, what's next?
What's next is really for us to be able to come to grips that, we're going to have vaccines. These vaccines are going to have tremendous efficacy in reducing hospitalizations and deaths, but they have also some limitations, right? What we've learned is that mutations have come up with the COVID, and there's new variants that are coming out. So we're going to have to get boosters. But then the reality is that, Connor, there are certain patients who cannot be vaccinated, or the vaccines don't work for them, specifically the blood cancer patients, or patients for a variety of other reasons who are not going to get the vaccine. So it's not just about the vaccines, but how do we move forward as a community, as researchers, as patient advocates, as healthcare professionals in providing care to those individuals through either antiviral therapy that's out there, antibody therapy that needs to be out there and as efficacious, if not more, than the oral antivirals? And how do we ensure that those therapies get to the patients in a timely manner?
Okay, so let's start with the antibody treatments. We constantly hear about this idea of herd immunity or natural immunity. What are the benefits of these antibody treatments? Why can't we rely on these natural immunities?
So natural immunity is great, right? Don't get me wrong. I mean, eventually we want to get to a point that we have herd immunity, we have natural immunity, and I get a lot of questions from people who come up to me and say, look, I've had COVID, I developed antibodies, so do I really need to get vaccinated? And my answer is very simple. I said, yes, you've had COVID. You're fortunate enough to be talking to me at this point because there's a lot of people who are not so fortunate to have passed away. So you can take the chance of getting sick, developing natural immunity through antibody development in your body, or you can get the vaccine to ensure that you're not going to end up dying. And that's the case here, is that the antibodies, the natural immunity antibodies are important, but they're not really realistic if you want to reduce the burden of illness and possibility of mortality. Now, the antibody treatments themselves have a lot of potential because they're not only about treatments. Antibodies that have been developed are also for developing immunity, treatment, and prevention eventually. So those are treatments that are available currently in the market, although not to the extent that we have the vaccines. And the reason being, and we can talk about the challenges that they haven't been able to be coming out into the marketplace as quickly and as efficiently as the vaccines and the oral antiviral therapies have.
So let's go there. What do you think is causing that? What is, in your opinion, the biggest hurdle to bringing these new treatments to the market if we're seeing so much success with them?
I think it has to do, and it's not a thing, I believe it is the Food and Drug Administration. They're under the impression that you need to develop these antibodies. They know they're important therapies, but they want to follow a path that you have to go through with regards to an approval process that is probably outdated. Because by the time that you do the clinical trials and everything else, we're moved on to a new mutation. So what the Food and Drug Administration needs to do is really go back to the drawing board and rethink about what the approval process for these antibody therapies should be. We've seen how flexible they are with the vaccines, right? This new variant that came out recently, they didn't even do clinical trials. They did primarily, in vitro studies to get it approved. And I think that they need to really start rethinking about the approval process of these antibody therapies, because clearly we know, even though the vaccines are super important and super efficacious, there's just a group of people who are not going to get vaccinated, and a group of people who, like my friend who I just ran into a couple of days ago, who is in remission from leukemia, that the vaccines are not going to work for. So we need therapies for those individuals.
Well, something that's been coming up a lot recently, Robert, have been some studies that folks in our patient community are reading about in Wall Street Journal and other places about some BCG and flu vaccines and how they would be used for COVID. What can we tell them about these studies and about these new treatments? Is this something that we should keep our eye on? Should they be worried? Or is this what we've been talking about this whole podcast, which is just another advancement and another tool to fight this disease?
So, as always, science evolves, right? We talk about that in our podcast all the time. And in case of BCG, it's interesting. BCG vaccine has been around for decades. In fact, I may be the only one among the three of us, you, me, and our producer, Ben, who probably got the BCG vaccine because of where I was born and raised. So BCG vaccine is for tuberculosis. And the reason that I got it is because I'm from a country that had a very high prevalence of tuberculosis. When I moved to the United States, we don't give that vaccine anymore here because there's low risk of infection. There's some variable efficacy against adult pulmonary tuberculosis and potential vaccine interference with skin tests, which is very important because we do skin tests to monitor for tuberculosis breakout in this country. So BCG has shown some potential. There was a study that was done that got a great deal of coverage. Wall Street Journal covered it, New York Times covered it, and we did get a lot of questions. I got a lot of questions personally from the individuals. And it has some broad protection levels with regards to respiratory infections. This should not be a surprise. More studies need to be done to confirm. It was a small study that was done of patients who were tested, who got the BCG vaccine versus placebo in development of the COVID. But at this point, Connor, what I tell patients who approach me, or what we should tell the individuals who approach you, is that stay tuned. More data is going to be done. We need more information. But no, this is not potentially something that you should be running out and trying to get the BCG vaccine as a patient, that we have other vaccines available for COVID. And we have treatments. And as I said, we need to develop more antibody therapies. But at this time, as always, it's good data and science evolves and we will see where this takes us. There may be some potential for it.
And Robert, I think one of the silver linings that we can take away from this pandemic was so much time, money, research, and development was put towards finding a cure and medical advancements. And we're seeing those pop up in a lot of different places, that the research and some of the technologies that have really been studied and advanced during this this pandemic. They're finding new uses and we're finding ways that they can treat other things. Can you tell us a little bit more about that?
I couldn't agree more. I mean, it's one of the very few silver linings, right? That there's been a re-emphasis in looking into infectious diseases more as a research environment. It's also the development of the mRNA platform, because as we've discussed in this podcast, the mRNA platform has been around for a long time, but it didn't have any usage, practical usage for treatments or vaccines or anything else until the breakout that we've had. So there's definitely been the evolution of science that we've seen. And this is good for patients and this is good for our patients, right? Because the more focus is made into new therapies, new areas of research and everything else, this helps patients who unfortunately are going to need these therapies long term. And, although our organization focuses on chronic diseases primarily, we are very much a vaccine patient advocacy group. And not only a vaccine patient advocacy group, but infectious disease patient advocacy group. So things like vaccines and antibody therapies and oral antivirals are super important for our patient population because inherently chronic disease patients are immunocompromised and they will need a lot of different therapies for help.
Yeah, Robert, you're talking about how we're trying to make these therapies and these vaccines more accessible to folks. And one question that comes up is I've recently learned that a large portion of the adult population has some sort of needle phobia. And I think we all were scared of needles as kids too. So what are some other options that are available for folks that, like you were saying earlier, maybe unwilling, unable, or in this case, just a little nervous about this mechanism of administration?
So that's a great question. So, it's a little bit of an unknown, but there's a good percentage of adults who are needle phobic. So if you have needle phobia, it's going to be hard for you to get the vaccine, or it's going to be hard for you to get the antibody therapies because they're infusions, right? Or injections. So there are alternatives that are being worked on. And one of the things that, we were discussing prior to starting the podcast is potentially nasal administration of the vaccine through the nasal route. And it's great. They're working on it and, they're going to come out with it. And we do have administration of the flu vaccine through the nasal passage. But that doesn't mean that we should stop and we should continue the research in those areas because, as I mentioned, there is a good percentage of adults who have needle phobia. So it is a good thing. Again, one of the silver linings is that we're going to continuously invest in this type of research opportunities.
Insightful as always, and I want to make sure you get the last word, Robert. But what I'm kind of taking away from this conversation is we're seeing some waning of this pandemic. It's certainly not over, and if we don't continue our mitigation strategies, we could be in for a rough winter. But there are a lot of advancements that are coming along and really helping patients and helping folks beat this disease and keep folks out of the hospital. But there's a lot of red tape involved that is slowing down some of this advancement that we're seeing. That's just my take. What do you think, Robert?
Similar. I mean, we have a pandemic that sort of goes through peaks and troughs, right? So we're at the trough right now. We don't know what's going to happen with the winter months coming on upon us. We already see that there's going to be some harsh flu season. That's another thing that we need to remind our listeners. Go get your flu vaccine. Don't forget about that one. So we are at a trough with COVID, but that doesn't mean we stop the research. That doesn't mean that we take off our foot from the gas pedal. It's important for us to continue the research, but not only in the vaccine and promotion of the vaccine, but also understand that research needs to be done in oral antiviral therapies, in antibody therapies that are going to be so critical. And most importantly, what you said at the end, which is the red tape. It's the bureaucracy that we cannot go back to, especially when it comes from the Food and Drug Administration. They need to understand that these antibody therapies are critical. I think the administration does. I think Congress understands those things. But the FDA needs to change the way they're looking at the research and how that should be completed and to get approvals for these medicines or emergency authorizations, because they're going to be critical for a certain segment of the patient population for whatever reason that the vaccine either is not going to work or they're not willing to take the immunization, the vaccination, that we do need those opportunities for those patients to be taken care of.
Well, as always, thanks for breaking that down for us and for the update, Robert. I know that our listeners really care about where we're at with this COVID pandemic, so I know they're going to like this one. Some really valuable information for our listeners. And to our listeners, don't forget to subscribe to our podcast on Apple, Spotify, or wherever you might be listening, so you'll never miss an episode. And if you have a second, help spread the word by rating our podcast, writing a positive review, and sharing with your friends and family. It'll help more people like you find us.
And I have to say, Connor, I've gotten a lot of good feedback about the last 2 podcasts that we did. One specifically related to how patients can save money by paying cash for their generics, and also the 340B one we did last go around. A lot of good feedback. And for our audience, if you want to send us an email or an audio clip, please send it to healthcarematters@ghlf.org, and you might be featured in one of our upcoming episodes. And before we go, make sure you take a listen to some of our other great podcasts on the GHLF Podcast Network.
That's a great point, Robert. Actually, in last week's episode of The Health Advocates, our friends and colleagues Stephen Newmark and Zoe Rothblatt discussed vaccine skepticism, which, it's a worrisome trend that goes beyond COVID-19, but very applicable to our conversation today. If you haven't done it already, make sure to give it a listen. And remember, you can find all of GHLF's podcasts at ghlf.org/listen. He's Dr. Robert Popovian.
And he's Connor Mertens. We'll see you all next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.